My name is Charl Els, and I'm a clinical professor in the Department of Psychiatry, and I'm appointed as a physician educator in the Division of Preventive Medicine at the U of A. This brief session focuses on the concept of maximum medical improvement, or MMI. Thank you to the WCB of Alberta for making funding available for this project. There are no conflicts of interest to declare, and the opinions expressed here certainly are not necessarily those of any collaborator or funding agency. At the end of the session, participants will be equipped to recognize the concept of maximum medical improvement and articulate the conditions under which MMI is reached. What is maximum medical improvement, or MMI? In psychiatric disability assessments and in occupational health practice, physicians are occasionally required to comment on whether maximum medical improvement has been reached. MMI is the point at which the illness or injury or functional loss has improved as much as it's likely going to, and no further change in the medical condition is expected within the next arbitrarily set 12 months, irrespective of further application of treatment or interventions. When a person has reached the point of MMI, the condition is considered to have stabilized, even if the person is still very ill or of poor functional status. And any functional or further functional improvement is unlikely, even with further treatment. At the time when the claimant or worker or patient has reached the point of MMI, the physician may then begin to determine the degree of impairment or establish the degree of impairment, be it partial or complete, at that point likely permanent, that will affect the claimant for the rest of his or her life. Importantly, MMI is a medical concept, not a legal or administrative concept. Primarily, MMI determinations are conducted by a medical professional, typically in an independent context, for example, by conducting an independent medical examination, or IME. MMI determinations that would impact disability adjudication should preferably not be offered by a treating physician primarily, unless no other option is reasonably available. MMI determinations have to be based on a comprehensive assessment of all conditions, the presence, in other words, of comorbid conditions, some of which may not be compensable, but which may influence recovery. And these determinations should, as far as possible, be based on objective findings. The opinion provided by the assessing physician outlining the degree of impairment and the relative permanency of disability, as well as MMI, will likely impact compensation in the long term. Despite the importance of such, there are no published criteria or actuarial determination methods by which MMI status is objectively established. It's rather based on a case-specific foundation, based on the opinion of a medical professional, and it should be on the basis of objective evidence. The level of certainty, of course, is that of a balance of probabilities. Estimated MMI duration is different for different medical and psychiatric conditions, and there are some indications of duration for each of these. For example, for alcohol addiction, MMI is usually expected within 6 months of treatment or less. Different conditions have different MMIs, and these are estimated under the assumption that the additional complexities involved in the psychiatric diagnoses have been taken into consideration. For example, for a psychiatric condition, if there's a comorbid substance use disorder, it has to be taken into account. There's, however, little information on MMIs for combinations of illnesses. The American College of Occupational and Environmental Medicine, or ACOM, offers information on a variety of conditions and their MMIs. It's available on their guideline website, published by the Reed Group. MMI is a useful concept that provides an indication of the duration in time for an injured or impaired by illness employee to reach a state where his or her condition cannot be improved any further, or when treatment has plateaued. Thank you for your attention. We look forward to your feedback and comments, and please help us identify further topics for future discussion. Thank you.